Welcome to this lecture, where we dive deep into a topic that impacts millions, but often goes unnoticed until it's too late. Imagine this: you're going about your day, but something isn't right. You're feeling constant heartburn, maybe even sharp abdominal pain. You brush it off at first, but it persists, wearing down your energy and affecting your appetite. Eventually, you can't ignore it anymore. If you've experienced anything like this, you might be dealing with more than just normal acid reflux. You could be facing a condition where your stomach produces far more acid than it needs, causing discomfort and, over time, potentially serious complications. Today, we'll explore why this happens, the conditions involved, and what can be done to manage them. What are pathological hypersecretory conditions? At the core, pathological hypersecretory conditions are disorders where the stomach cranks out more gastric acid than necessary. Now, stomach acid is not a villain in itself. In fact, it's essential for digestion, breaking down food and protecting your digestive system from harmful bacteria. The problem arises when there's too much of it, leading to symptoms that range from annoying to downright debilitating. The chronic excess of this acid can damage the stomach lining and lead to serious health issues if not properly managed. These conditions can be caused by various underlying issues, sometimes due to tumors, sometimes because of infections, and occasionally due to rare genetic conditions. By understanding these triggers, we can better grasp why treatments vary and how they're tailored to different situations. Common types of pathological hypersecretory conditions. Let's look at some key hypersecretory disorders. While each has unique characteristics, they all share the common thread of excessive gastric acid production. 1. Zollinger-Ellison syndrome, ZES. First, we have Zollinger-Ellison syndrome, or ZES. This is a rare condition that arises when small tumors called gastrinomas form, usually in the pancreas or duodenum, an area referred to as the gastronoma triangle. These tumors release gastrin, a hormone that overstimulates acid-secreting cells in the stomach. So, what happens? The stomach produces acid at levels far beyond what's needed for digestion, leading to symptoms like severe, recurring ulcers in the stomach or small intestine, persistent abdominal pain, chronic diarrhea, acid reflux, and heartburn. ZES is typically treated with surgery to remove these tumors. Medications are also available to reduce acid production and protect the stomach lining. 2. Helicobacter pylori, H. pylori, infections. Another common cause of hypersecretory conditions is H. pylori infection. This bacterium lodges itself in the stomach lining and can cause inflammation, known as gastritis, and eventually peptic ulcer disease. H. pylori infections often don't show symptoms initially, but once they progress, symptoms can include annoying or burning pain in the stomach, bloating and nausea, indigestion and burping. Treatment for H. pylori involves antibiotics to eliminate the bacteria, often combined with a proton pump inhibitor, PPI, to reduce stomach acid. However, a growing challenge is antibiotic resistance, making it increasingly difficult to completely eradicate the infection with standard treatments. 3. Short bowel syndrome, SBS. Next up is short bowel syndrome, a condition that stems from the removal or shortening of a portion of the small intestine, often due to surgery. Although it's not directly about acid overproduction, SBS leads to malabsorption issues, which can cause nutrient deficiencies. Symptoms of SBS range in severity, with some individuals experiencing chronic diarrhea, fatigue due to nutrient deficiencies, abdominal pain and cramping, frequent acid reflux. SBS is managed with a blend of dietary adjustments, nutrient supplementation, and medications to help promote nutrient absorption. In severe cases, individuals may require intravenous nutrition, total parenteral nutrition, or even an intestinal transplant. 4. Chronic kidney disease, CKD. Chronic kidney disease, or CKD, might not seem immediately related to hypersecretory conditions, but it plays a role in regulating the body's acid-base balance. In the advanced stages of CKD, patients might experience an imbalance that leads to increased acid levels in the stomach, which can cause nausea and vomiting, persistent fatigue, muscle cramps, swelling in the feet and ankles. While kidney damage is often irreversible, CKD treatment focuses on slowing disease progression, managing symptoms, and potentially reducing acid buildup. Options include lifestyle changes, dialysis, and for some, a kidney transplant. 5. Antral G cell hyperplasia and antral gastrin cell hyperfunction, AGCH. AGCH is a rare cause of duodenal ulcers that arises from excessive gastrin production in the stomach, which stimulates overproduction of gastric acid. Symptoms of AGCH may include intense abdominal pain, frequent episodes of acid reflux, nausea and vomiting, peptic ulcers. Treatment for AGCH often includes medications like PPIs to reduce acid production. In severe cases, surgery may be considered. 6. Retained gastric antrum syndrome. Finally, we have retained gastric antrum syndrome. This condition occurs post-gastrectomy or gastric resection and leads to disrupted digestion due to remaining parts of the stomach releasing gastrum, causing acid overproduction. Common symptoms are pain and discomfort after eating, bloating, nausea and vomiting, delayed gastric emptying. Treatments for this syndrome involve medications that aid in gastric emptying, dietary changes, and sometimes corrective surgery. Factors contributing to hypersecretory conditions. It's worth mentioning that factors like stress, certain medications, and even genetics can contribute to hypersecretory conditions. Understanding what sets off these issues can help individuals and healthcare providers develop better treatment plans. Treatment options for hypersecretory conditions. While each condition may have its specific treatment protocols, most involve reducing acid production, protecting the stomach lining, and addressing any underlying causes. Common treatments include proton pump inhibitors, PPIs. These drugs are designed to reduce the stomach's acid output and are commonly used to treat conditions like ZES, AGCH, and H. pylori infections. Surgical interventions. Surgery is often necessary to remove tumors in ZES or to correct anatomical issues in retained gastric antrum syndrome. Dietary modifications. For conditions like SBS and CKD, dietary adjustments play a significant role in symptom management and ensuring that the body gets the nutrients it needs. Total parenteral nutrition, TPN. This is typically used for individuals with SBS who cannot absorb nutrients effectively due to shortened small intestine. The outlook for individuals with hypersecretory conditions. The outlook for people with hypersecretory conditions varies depending on factors like the condition's cause, the severity of symptoms, and how well the individual responds to treatment. With early diagnosis, treatment, and effective management, many patients can achieve a good quality of life, managing symptoms and preventing complications. Final thoughts? Pathological hypersecretory conditions can be life-altering, but with the right treatment plan, they can be managed. The key is awareness, knowing the symptoms, understanding the causes, and seeking medical help when necessary. By taking a proactive approach, individuals can regain control over their health, potentially reducing symptoms and improving their quality of life. If you've experienced any of the symptoms we discussed or know someone who has, consider talking to a healthcare provider. Thank you for watching, and remember, your health is worth every effort. Stay informed, stay proactive, and take charge of your well-being.